Okay, so what is this slide? Can someone identify what this is?
Can it be intubation tube?
Max.
Okay.
Endotracheal.
Laryngeal airway.
Sorry?
Laryngeal max airway.
Correct. That's it. That's laryngeal max airway. Okay.
Laryngeal airways.
Laryngeal mask airway. Mask. The mask.
Okay.
Face mask.
Okay. Thank you.
Laryngeal mask airway. So this part, this part here, right, is a part that sits on the larynx. You can see it, right? You can see my cursor, right? Right? So this part what sits in the larynx, and this tube is what is connected to the machine that gives the oxygen and the anesthetic medication. This tube in here is what is used to inflate this cuff to make it tamponade the oropharynx, then secure the laryngeal max airway in place. So what are the indications of the laryngeal max airway?
Administration of anesthesia.
Anesthesia is a big word, hope you know. Anesthetic gases. Use what anesthetic gases.
Yes.
Because anesthesia is just simply making someone to sleep. So it's like saying administration of making someone to sleep. You get that word is big. So is to can use to deliver anesthetic gases. Correct. I don't know if you get me correct. Okay, what else again can you use to do? Can this be used for? It can be used to deliver oxygen. Right? So instances where there's no endotracheal tube and you want to give someone oxygen and there's perhaps no indication for face mask may not be appropriate. You can pass this thing down there and then deliver oxygen directly through the larynx to the trachea. So what are the contraindications? Two contraindications to this. Usually one is very long procedure. Any procedure is up to 4 hours. More than 2 hours. 4 hours may not be this may not be the appropriate means. Another one is a patient that has full stomach. Full stomach means someone that has the propensity to regurgitate in surgery. Vis-a-vis someone that just finished eating before surgery, a pregnant woman, someone that has an abdominal surgeries, or a full stomach, they have the propensity to regurgitate during intubation. So this is contraindicated. The complications of this is that this tube itself it can displace because it cannot be, we cannot say it is very efficiently stable compared to the endotracheal tube or because of the nature. So this thing can get displaced. Even the endotracheal tube can also get displaced. So one of the complications is that it can get displaced and therefore you have problem with delivering whatever you are delivering, either the anesthetic gases or oxygen. Another complication of this again is that it could also injure surrounding structures, vis-a-vis the oropharynx by administration. When you place this, you can injure it. Then there's also a risk of regurgitation. These are some of the complications that one can get from this procedure. Cool. So can someone identify this? This is next slide now. Can someone identify this?
This elephantiasis.
Well, I agree with you. So I'll agree with you. If you say elephantiasis, yes.
Filariasis.
No.
Okay.
If you say elephantiasis, I will agree with you. I don't think you will fail the exam if you say elephantiasis. So, but that is not really the answer. Why it's so is that. Sorry.
Wuchereria bankruptcy. That is that.
No. No.
Okay.
Now, if you say elephantiasis, right, you will not fail the answer. You won't fail it too, but if you have someone that's a plastic surgeon that runs you, he may score a little bit low. Why? This is lymphedema. Elephantiasis, that what elephantiasis is stage 4 lymphedema. You understand? And truly, this is stage 4 lymphedema. So if you say elephantiasis, you are right. But this is stage 4 lymphedema. So the common terminology for stage 4 lymphedema is called elephantiasis. You get? So in that instance, you'll not be wrong. Or rather, it will be, if you want to use elephantiasis, fine. Yes, you say it is right up lower limb elephantiasis, but the proper term will be right unilateral lower limb lymphedema. That will be the proper term. Are we communicating?
Yes, sir.
Okay, so this is right unilateral lower limb lymphedema. So can you list 2 causes? Because this is what elephantiasis, they are most likely restricted to the answer you are giving. But once you understand that this is a lymphedema, the problem is a lymphedema. For us now, they ask us to grade it, and then you now see this is grade 4 lymphedema. The local name for it is called elephantiasis and co. But the right terminology is right lower limb lymphedema. So can you list 2 common causes of lymphedema, or if you want to call it elephantiasis, as you want to call it?
Infection.
Okay, can someone answer the question? Sorry?
Infection.
Could you come again?
Infection.
Infection is a big term, you get, and nobody is going to pass if you use word infection, you get. You have to be specific.
I think it's a mosquito.
Sorry?
I think it's a mosquito.
No, you mentioned those infections you're calling before now, filariasis, right?
Okay, yes.
Filariasis can cause this, right? You are right. That's one. What did that cause again? You can see that when you use word elephantiasis, now you are stopped, because what is commonly known as elephantiasis is by those lower, which are bankruptcy, and filariasis. All the filariasis, it's commonly straight with that. So once you use word elephantiasis, you are tied up. Once you understand that this is lymphedema, you can then know that there are multiple causes of this. So I'm going to list as much possible causes so that subsequently you will have enough options. One, like you said, infestation. What is not infection? Infestation with filarias, such as Wuchereria bankruptcy, lower and co. That's one possible cause, and that's a common one. The other one is deep vein thrombosis can cause the same problem. Deep vein thrombosis. The other one can be a tumor, an intra-abdominal tumor. Can cause this problem. Then another cause can just be congenital. The patient was born with the problem, but only manifested in utero. So having talked about the cause, but commonly what you should not forget, deep-vein thrombosis, intra-abdominal tumors, filarial infestations. Those are the common causes. This thing can also occur from trauma. Someone has an injury that involves that later destroy the lymphatic the terminal drainage lymphatic system. Maybe had the femoral fracture and then destroy the terminal drainage lymphatic system from the lower limb. Patient can come down with this. So list 2 complications of this disease. Can someone attempt it?
Cancer or sepsis.
Sepsis, yeah. Infection, yeah. Correct. Infection, yeah. That's one, but not cancer. Cancer, yeah. But that should be down the list.
Ulcerations.
Yes, you can get ulcerated. Yeah, I agree with you. Ulceration is a complication. Cancer can occur, not that you could have malignant transformation of the skin. You can later develop squamous cell carcinoma and something like that. But that is usually a least complication. It should have occurred when most of other complications had occurred and they're not treated. Then, but should come down. Ulceration is one. Can get infected. That's 2. You have difficulty walking. That's a complication.
Pulmonary embolism.
Pulmonary embolism, not really. Why is so is that in pulmonary embolism, what usually happens is that there will be a clot that would have been dislodged, and then it would have formed an embolus that would have moved and then settled somewhere in the lungs, right? But in this instance, if it's caused by deep-vein thrombosis, right? That deep-vein thrombosis, whatever it is, may have the thrombus there, you understand, may have consolidated and then obstruct venous return, and by consequently increase lymphatic interstitial pressure and then cause lymphedema. Yes, so there will be no issue of an embolus forming. So a pulmonary embolism person may not be a direct complication from this disease. Yes, ulceration, yes, is a direct complication. This thing can become ulcerated. You could have difficulty walking, yes, that's a possible complication. You can have low self-esteem because of the way this thing is. That's a complication. This thing can get infected. That's a complication. Can someone list treatment options? This may be a little bit. Let's see. Let's see if we can try. But there are some that's not above your level. So you can talk about one treatment option, or maybe two. You can try, but you can try. What are the possible treatment options?
You can use ivermectin.
Sure. Ivermectin, yes, that's for when it's caused by filariasis. I agree with you. Yes. Commonly, treatment will be compression therapy, then surgery.
Elevation.
Are you okay? The treatment option will be compression therapy and surgery. Ivermectin will not treat this lymphedema. It will treat the infection, but this lymphedema will still be there. So ivermectin will treat the infection. If it's caused by filariasis infection, it's going to treat the filaria. It's going to kill it off, but it will not treat this lymphedema. This lymphedema will be treated by compression therapy and possibly surgery. The type of surgery is beyond your exam. It's in our exam. We'll talk about obstructive and then physiologic surgery, and then what other type of surgery again? That's the two broad categories, but that's beyond this. So if you say surgery as one treatment option and compression therapy as second treatment option, you are good. That's why if you use what elephantiasis, you will be restricted because you'll only be looking at the type 4 type commonly associated with infestation, right? But if you understand that this pathology is not elephantiasis, lymphedema, which can have a grade 1, grade 0, grade 1, grade 2, grade 3, grade 4. We don't understand that the problem is not just the colloquial name they call elephantiasis, because that is what people understand it to be. It's like an elephant leg. But it's rather a problem with the lymphatic system. So what 2 modalities of investigations can you do for this patient? Can someone attempt? Okay, one of them is lymphoscintigraphy. Lymphoscintigraphy, that's one of the investigations you can do for them. You can also do a Doppler ultrasound scan for them. You can also do an MRI for them also too. So these are possible investigation. MRI will pick the soft tissue component. A lymphoscintigraphy will pick the lymphatic drainage pattern for you. So that will end this. Is there any question before we move to the next possible slide? Is there any question? Okay, so I guess no question, right? So let me end this slide so that.
Sorry, what was the modalities for investigation? Is it?
We have lymphoscintigraphy. It's one of the modalities of investigation. You can do it in magnetic resonance imaging. Please in your exam, do not write initials like MRI. Write it magnetic resonance imaging, lymphoscintigraphy. The other tests, what are the common ones that I think you should know? So is there any other question again? So I will stop this recording for so that if you want to go through it, you can easily go through them. They will not be too very long.